The STAR program is a alternative response model to behavioral health crises that are coming across 911 that started in 2020 with one van and has expanded to 5, and really engaging community members that are in crisis where historically police have been sent. But instead we're sending clinicians and paramedics to actually go and meet the need of what that individual is looking for, instead of sending a one-stop shop of a police officer.
I think that it's a success because we get to partner with Denver 911 and serve people on their absolute worst days. As a social worker, I get to meet them in the moment, and I get to meet them in a spot that empowers them for their voice to be heard.
We're also seeing people who are struggling with homelessness, as well as substance abuse and any types of mental health issues or mental health history. Those are the clients that we're seeing the most right now.
So we're very good at sending people to emergency rooms. Any unit can do that. What Health One can do, our co-responder program can do, is send people to homeless shelters, to clinics, to outpatient-based programs, to sobering, back to their house if that's where they need to get. We have a lot of tools at our disposal for that our operations members don't have.
All right. Thanks. Okay, bye. What they said? Okay. She can't express it.
Another one might be de-escalation and crisis intervention. So that requires really 2 things that often operations doesn't have: a large amount of time and specialized knowledge and training. So our folks are very good at that. They are very proficient in de-escalating clients who are in behavioral or emotional crisis, and they have the time to spend. If that takes 2 hours, they can spend 2 hours. An engine or an aid car can't spend that time. They have to get back in service.
We really can sort of like pick through with a fine-tooth comb and find the best option for someone. And that sometimes that option is they have everything, there's nothing more we can do, but a lot of times we can connect them to things that they would never have been able to be connected to just with a fire engine or a regular operations crew.
When I worked on the ambulance and only being able to really transport people to the ER, knowing that maybe that's not the best thing for them, it kind of gets to you after a while. So being able to be on the starter van and being able to take people where they really want to go and helping them or guiding them to the resources that they really need, that's reassuring, and I guess I can go home every day knowing that I helped someone.